Pediatric history taking and examination. History taking. 1. Introduction and rapport building. Establish a comfortable and non-threatening environment. Introduce yourself and engage the child and parents in conversation. 2. Chief complaint. Ask the parents or caregivers to describe the main reason for the visit. 3. History of present illness. HPI gather detailed information about the child's symptoms, including 1. Onset and duration. 2. Severity and frequency. 3. Associated symptoms. 4. Aggravating or relief. 4. Past medical history. Inquire about 1. Previous illnesses or hospitalizations. 2. Allergies. 3. Immunization status. 4. Developmental milestones. 5. Family and social history. Explore 1. Family medical history. 2. Social and environmental factors, e.g., living situation, parental occupation. 3. Childcare or school arrangements. 6. Review of systems. Ask about 1. General health and well-being. 2. Feeding habits and appetite. 3. Bowel and bladder habits. 4. Sleep patterns. 5. Developmental and behavioral concerns. Examination. General inspection. 1. Vital signs, record temperature, pulse, respiratory rate, blood pressure, and oxygen saturation. 2. Growth parameters, measure and plot height, weight, and head circumference on growth charts. 3. Overall appearance, observe the child's 1. Posture and gait. 2. Facial expression and eye contact. 3. Skin color, texture, and lesions. 4. Hair and nail condition. System-specific examination. 1. Cardiovascular. 1. Auscultate heart sounds. 2. Check for signs of heart failure, e.g., edema, respiratory distress. 2. Respiratory. 1. Auscultate lung sounds. 2. Observe respiratory rate and effort. 3. Check for signs of respiratory distress, e.g., wheezing, retractions. 3. Abdominal. 1. Inspect the abdomen for distension or masses. 2. Auscultate bowel sounds. 3. Palpate the abdomen for tenderness or guarding. 4. Neurological. 1. Assess mental status and level of consciousness. 2. Evaluate cranial nerves. 3. Check for signs of neurological dysfunction, e.g., weakness, tremors. 5. Musculoskeletal. 1. Inspect joints for swelling or deformity. 2. Assess muscle strength and tone. 3. Check for signs of musculoskeletal dysfunction, e.g., limited range of motion. Developmental and behavioral assessment. 1. Developmental milestones. Assess the child's 1. Gross motor skills, e.g., sitting, walking. 2. Fine motor skills, e.g., grasping, drawing. 3. Language and communication skills. 4. Social and emotional development. 2. Behavioral assessment. Observe the child's 1. Behavior and temperament. 2. Interaction with parents and environment. 3. Response to stimuli and stressors.